What if I told you that a simple change in your daily routine could drastically reduce your risk of chronic diseases and premature death? Physical inactivity is a silent killer, more prevalent than any other modifiable risk factor. Over 51% of adult Canadians are physically inactive, putting them at higher risk for diseases like cardiovascular disease, diabetes, and cancer. But there's hope. Regular physical activity can significantly reduce these risks. Studies show that even modest increases in physical activity can lead to substantial health benefits. For instance, just 1 hour of walking per week can lower the risk of cardiovascular-related death in women. The benefits of physical activity extend beyond just preventing diseases. It can also improve your overall quality of life and mental well-being. Imagine reducing your risk of death by 20–35% just by being more active. Increased physical fitness is associated with a greater than 50% reduction in the risk of death from any cause. Even small improvements in physical fitness can lead to significant health benefits. For example, people who went from unfit to fit over 5 years reduced their risk of death by 44%. Physical activity is not just about preventing diseases, it's also about managing them. Patients with established cardiovascular disease can benefit greatly from regular exercise. Exercise can halt the progression of coronary artery disease and even reduce plaque in the arteries. For those with diabetes, regular physical activity can improve glucose control and reduce the risk of premature death. Walking just 2 hours per week can reduce the risk of death from any cause by up to 54% in diabetic patients. Physical activity also plays a crucial role in cancer prevention. Routine physical activity is associated with a 30–40% reduction in the risk of colon cancer. Physically active women have a 20–30% lower risk of breast cancer compared to inactive women. Even for those with cancer, regular physical activity can improve survival rates and quality of life. Exercise is also vital for bone health, particularly in preventing osteoporosis. Weight-bearing and resistance exercises can increase bone mineral density and reduce the risk of fractures. In older adults, regular physical activity can prevent falls and maintain functional independence. Musculoskeletal fitness is crucial for maintaining the ability to perform daily activities. Enhanced musculoskeletal fitness is associated with a lower risk of chronic diseases and disability. The benefits of physical activity are not limited to the body, they also extend to the mind. Regular exercise can reduce stress, anxiety, and depression, improving overall psychological well-being. The current physical activity guidelines are sufficient to elicit health benefits, especially for previously sedentary people. However, engaging in higher levels of physical activity can lead to even greater health benefits. Health promotion programs should target people of all ages, as the risk of chronic disease starts in childhood and increases with age. Remember, the greatest improvements in health status are seen when the least fit become physically active. Start today and transform your life.